Yes, I went to AL.com last week, and on April 6th, actually, Mr. Sisk was an op-ed guest, and when I saw his picture and and the byline, I immediately was fascinated by knowing that Glenn has been very involved with this whole issue related to Medicaid. We've worked together on some other initiatives trying to help people get access over the course of the last couple of years. And I want to quote you because I think this sort of leads the conversation, as you so aptly did in this op-ed piece, when you said, and I quote, "With one vote, legislators declare to the people of Alabama their willingness to risk crippling a strong health care system rather than doing what is necessary to adequately fund it." Medicaid.
Yes. Extremely unfortunate. And I'll try to put that in context first, and then we'll talk about more specifics as we go. First of all, let me clarify this. Alabama hospitals are paid by Medicaid, but not a single penny of those payments come through the general fund in the state of Alabama. The way hospitals are paid is we have an assessment, a tax, if you will, on ourselves that we pay through a means called Intergovernmental Transfers. And this assessment then is used to maximize the federal match in this case at CMS in Baltimore, which is a 1 times 3 match. So we take the dollars that are generated from this assessment in Alabama, send them to the federal government at CMS. They match it times 3, and then those are the funds then that are used to reimburse Alabama hospitals for the work that's done. Now, that doesn't include physician payments, it doesn't include home care, all those sort of peripheral benefits, pharmacies, etc. But Alabama hospitals don't take a single penny from the Alabama General Fund. I think that's important for people to understand. So with this one vote that you just referenced, Margaret, what the Alabama legislature did was they said, in spite of the Medicaid commissioner, in spite of the governor saying we need $785 million to run Medicaid effectively at its current level, they voted and said we'll fund it at $700 million. So today we have an $85 million shortfall in the Medicaid program. We've been working now for about 4 years on a Medicaid Transformation model, which is the regional care organizations. You're familiar with that. We're very fortunate that you have the opportunity to sit on a board associated with those RCOs, which is the acronym. We have a lot of acronyms in healthcare.
Yeah, we do.
And the RCOs are intended to really focus on getting care delivered in the right place, the right time, much like we have advocated with the Get Healthy Talladega County initiative. There are 5 regions in the state. Those 5 regions are then approved for certain providers. And in our case, we're in Region B. There are 2 provisionally approved regional care organizations, and they're scheduled to kick off on October 1, 2016. With the $700 million funding that the legislature approved, those RCOs go away. So Medicaid transformation, as has been anticipated now for the last 4 years, is not going to occur. That $85 million shortfall, that's number one. Number two, what the Medicaid commissioner has come out and said, benefits are going to go away dramatically. And many of those benefits matter, and of course, depending on who you are and where you are in your health life, some matter, some don't. For example, the commissioner has said we're going to take away orthotics, we're going to take away prosthetics, we're going to take vision care away for Medicaid recipients. But then it begins to get a little more significant. She has also said at this funding level, we can't have outpatient dialysis. If you're familiar with the urgency and the importance of having outpatient dialysis occur for those patients 3 or 4 days a week that are on that program, that goes away. What happens to those Medicaid recipients? We don't do inpatient dialysis in Sylacauga, so those folks would be forced to travel, likely in this case, to Birmingham hospitals, and travel for many of the Medicaid recipients is a limiting factor.
Exactly.
One of the other challenges we faced in the state is a lot of primary care physicians have chosen not to take Medicaid in the state of Alabama. So access for recipients has been challenged. However, a few years back, a decision was made that with the Affordable Care Act and the opportunity the state had to change reimbursement for Medicaid for primary care physicians, instead of being paid a Medicaid rate, they would be paid at a Medicare rate, which was an incentive for many primary care physicians to begin taking Medicaid. The commissioner has said that bump goes away. She's also said that for those who provide care to Medicaid recipients, and in our community, if you look at the pediatric community,
Yes.
the majority of patients that are seen by pediatricians in Sylacauga, in Talladega, are Medicaid recipients. They're going to take a 22% reduction in their reimbursement. That's dramatic. There is an example in the state down in South Alabama where a pediatric group had announced that they were, as a matter of fact, they had been
Dale
providing
County.
a satellite clinic. They were about to invest several $million in a new building. With this announcement, they've said no. So not only is it a public health issue in terms of access for Medicaid patients, but that's a great example of how the economic benefits that a vibrant healthcare system, and in this case with Medicaid, could add to a community's benefit, and now all of a sudden that goes away. So it's really very, very unfortunate, and frankly it's difficult for me and many others to understand how the legislature could make this decision, understanding the consequences that are to follow, because they're very real.
You've described the Medicaid recipient beautifully. It's a child, it's a senior, it's a pregnant mom, it's a baby. But what do those faces look like, and what are those stories? I remember a very poignant story when you all helped to open the doors for people to see if they were eligible for the Affordable Care Act, and those individuals who we hear about the gap, and how many residents of Alabama are really in the gap who do not have access to health insurance, Medicaid or otherwise. But this was a story of a young woman who had worked in public health, and because of the economy, and when the economy went, what happens when the economy has stressors, then people lose their jobs, and she did. And she was working at a job at one of our local vendors, restaurants, and she didn't have access to insurance, and she had 3 children, and she sat at the table across the table from me one day, and she said, "This is what I'm teaching my children. My children are learning that as I come in every single day, I've got blisters on the bottom of my feet, and I'm working as hard as I can, but I can't go to the doctor." And she apologized actually for having had insurance before, because she said, "I never used it because I didn't want to stress the system." But it was such a sad story of a person who ultimately she was eligible for Medicaid. Will she be now? Will her children be? That's the question. So as hard as she was working to provide for her family,
Right.
it wasn't happening.
Well, and unfortunately, we've not as a state taken advantage of Medicaid expansion. There are a lot of things about the Affordable Care Act that you'll hear people talk about that are problematic. Medicaid expansion has actually proven to be very, very successful around the country. Our governor and our legislature has said no. I think that's a travesty. Today, $3.8 million leaves Alabama to go support Medicaid expansion in other states. Now, let's do that.
Would you say that again?
Yes. Today.
Loudly.
Today, $3.8 million in taxes that are levied on people of this state are leaving Alabama and going to New York and Connecticut and other states to support Medicaid expansion. Those dollars were designated for the state of Alabama, and we've turned our back and walked away. The UAB study that was done on Medicaid expansion suggested that the state investment would be at or about $700 million over 10 years. But the return from the federal government was $11.2 billion. Now, those numbers are big and hard for us to understand, but think about that for a moment. If someone said, if you can give me $700 million, I'm going to write you a check for $11.2 billion, and the benefits that then provides to Medicaid recipients, to physicians, to pharmacists, to hospitals, is really, really proving to be very, very beneficial. And the thing that I'll point out is our Republican-led state has probably said no to Medicaid expansion because it was a Democratic initiative. Many states across the country now have said yes, led by Republican governors. And they're seeing real benefits in the state, not only from the healthcare infrastructure perspective, but also from a public health perspective.
Yeah. Exactly. Well, I think first and foremost, this is not scare politics. This is reality, and this is reality for the state of Alabama, and this is reality for our communities. This is reality for people and reality in people's lives, and no one can speak more eloquently about that than Glenn Sisk, because he sees it every single day. Not just the bottom line on the ledger sheet, but the faces of the people that will suffer because of this.
Very well said, Margaret. I think one of the points that is important to consider is dependency on governmental payers in this state is significant. In our case, about 50% of everyone who walks through our doors are Medicare recipients, and about 25% of those who walk through our door are Medicaid recipients, though they take up about 32% of our overall utilization. So when those programs begin to crumble and go away, all of a sudden that infrastructure is challenged. And I think, to your point, this perception that hospitals and healthcare and medicine is big dollar business. It's expensive business, but there are no margins. In the state of Alabama today, hospitals, 78% are operating in the red, meaning they're operating at a loss. So hospitals are significantly challenged from a financial perspective. I'd like to reinforce one other point, and that is, beyond the business of healthcare, the real life meaning of a patient who's on Medicaid, and Lori, if I may, the outpatient dialysis example we talked about a moment ago. Today in Sylacauga, we have 2 providers who provide 5 days a week of outpatient dialysis. SAFE provides transportation for many of those recipients. That's a fantastic program. And those people are being kept alive today. And I'm not trying to I'm not trying to create drama around this. It's just very real. They're being kept alive by those outpatient dialysis treatments. Let's fast forward 6 weeks from now. If that program goes away, that outpatient dialysis patient can't gain access to services here in Sylacauga. They show up in the emergency department at CVMC. Guess what? We don't provide that service on an inpatient basis. So now we're faced with finding a place for that patient to go. Is that Birmingham? Is that Montgomery? Maybe the answer is yes, maybe the answer is no. So then you begin to attack that from a time perspective, and all of a sudden you've gone days without treatments, and you can begin to see the challenges that faces from a public health perspective.
For the entire family as well, because that could be a parent or a grandparent caring for children as well, so it has an effect on the entire family system.
And likely the resources to ensure that transportation occurs to the communities outside of Sylacauga is not very, or Talladega, is not very high. So it's a very, very unfortunate set of circumstances, and something that I think people should understand. We've talked a lot about business, we've talked a lot about politics, but really at the beginning and at the end of each day, this is about people. This is about people's health, and unfortunately the ability or lack thereof to be able to provide care that's been so important to them.